Liposuction is a series of techniques that is designed to remove fat from under the skin in less invasive ways. There are several technologies out that are employed today, but in simple form, it involves a small incision, a cannula or a tube to extract the fat, and shaping of the tissues. There are various types of liposuction, whether it be conventional liposuction, where you use a suction machine. You can employ other techniques such as laser-assisted liposuction or ultrasonic-assisted liposuction. So really it's a catch-all phrase for a series of techniques that all have the same goal. Liposuction is a technique or a set of techniques that is really addressed in removing focal fatty deposits or focal areas in which a patient is displeased with, as opposed to a generic weight loss procedure. It is meant to treat isolated trouble spots, whether the abdomen, the thighs, the hips, etc. And it is used, when employed in the correct patient, can be a very powerful tool to help refine the body form and aesthetics. There are several techniques that can be used for liposuction and often depend on the patient and the patient's problem and the body area that is specifically going to be addressed. Those techniques can include suction-assisted liposuction, which involves a machine creating a vacuum to remove fat from underneath the skin with a tube. Other techniques also include the use of laser to heat up the fat and to help melt the fat, as well as ultrasonic energy, which essentially heats the fat as well in the underlying skin. And so really the technique depends on the patient and the body area, because each one of these techniques has advantages and disadvantages depending on the patient's body area that you're addressing, as well as other surgeon's factors as well. Tumescent is technically the liquid that is used in the liposuction process. Tumescent has several components. The main component is a salt water or saline type of component. There are other medications we also put into the tumescent, such as epinephrine or adrenaline, which constricts the blood vessels to help reduce any bleeding that's involved. And there's another component that helps numb or anesthetize the area of interest. And so this is a combination in all is called the tumescent. The important thing about tumescent technique is that it involves placing that liquid into the fatty area, allowing that tumescent to sit, to be absorbed by the body for both reduction in blood loss as well as increasing the patient comfort both during surgery and after surgery. The important thing about adding the tumescent is that it addresses several things. Number one, patient comfort during and after the procedure, because they are numb and they're anesthetized for a period of time. It also helps increase patient safety because bleeding is much less with the tumescent technique, and also improves patient satisfaction because it increases the level of your ability to take out finer amounts of fat and not over-sect something very easily. So it increases the margin of error, if you will, to make that patient's result better over time. The amount of tumescent that you use really depends on the body area and the patient's, actually, and the surgeon's preference for that technique. But the tumescent addresses very important factors of patient safety as well as patient comfort. The best candidates for liposuction, regardless of technique, are the ones who truly understand that this is not a weight loss procedure. This is a procedure that is best designed for patients who have troublesome areas that are resistant to exercise and dieting. This is often women who have tried for some months or years even to address their abdomen or their hips, but they understand that they're not coming in to lose weight. They're coming in to look better and to address certain problem areas in their body. The question about how much fat can be removed in a single sitting really lays in patient safety. We know that patients want a safe procedure, as do surgeons. And so when we look at complications from liposuction specifically, we know that the more fat is removed, the less safe the procedure can be when done in inappropriate situations or locations. And so really we try to address patient safety with each patient. At Park Meadows, we do not use liposuction for weight loss procedures, for extreme weight loss, or for weight management. It is those patients who do best, who we're most pleased with, and who the patients have the best results, are those who are addressing specific problem areas. The exact volume depends on the patient, and so I would say the average amount of fat that is removed can be anywhere between 1 liter and 3 and 4 liters. There is an arbitrary cutoff of high volume liposuction being anywhere between 4.5 liters and above, and this is when patient safety factors really become an issue, and it's better, in our opinion, to tread safely and to stage procedures for certain patients than to, quote, push the envelope and try to do something that may be reckless or has a higher risk or an unacceptably high risk of patient complications.